Dr. Tom Roselle live right now, 105.9 FM and AM 630 WMAL.
Welcome to Dr. Tom Roselle live. We are in studio on this absolutely gorgeous, fantastic Washington day. Oh God, it's back. I'm glad to see the sunshine out after all the rain and so forth and so on. But we've had some beautiful days. Anyway, I'm here to answer your questions on anything you'd like to talk about. Perhaps you've applied to some conditions and problems that you've had, and you've come up with the same old, same old. Not a whole lot of anything that really works. Well, here's your opportunity. This is the place that you talk to me, Dr. Tom Roselle, and we're going to come up with a solution without drugs, without surgery. We're here at 105.9 FM and AM 630 WMAL. Give me a call, 888-630-9625. That's 888-630-WMAL. Love to talk to you on any subject, of course. Got a couple of things for you today. We're going to talk about things that are in the news, some things that are controversial, some things that all of you know about, and then we're going to talk about a very amazing, absolutely fantastic lady that continues to say, age really doesn't matter. Dara Torres. Many of you know her as a multiple-time Olympian and a medal winner, and she's going to be back in the 2012 Olympics. We'll talk about what her secrets are and why she does what she does, and I'd like to talk about your problems as well. But first, I go through literature every week, and things keep coming up, and some things come up more often than others, and I want to let you know about them, because if you know about them, you can be proactive in your own health. And when you're in my office, I'm constantly bandering at you. But in the Journal of Nutrition, 2011, this last August, interesting article on green tea and how it affects the body's immunological system and its absolute protective effect against flu. So coming up in the flu season, and you know my opinion on flu shots, don't. Well, and there's a lot of reason for that, and we can get into talk about that in depth if you like. However, not the best thing you can do, because if nothing else, the effectiveness rate is only about 16 to 38%, and you have a better shot of not getting it if you do anything at all. So green tea, what's the hype about green tea? Well, in addition, coming up into the flu season, besides taking vitamin C and D and zinc, it's wise to regularly make a whole big pot of green tea. And according to the results of a Japanese study published in the Journal of Nutrition, again, 2011 in August, researchers at the University of Shizuoka conducted surveys of 2,050 pupils during the flu seasons, and this was over a period of time from 2008 to 2009, and the responses provided tremendous insight information relative to what the quantity of green tea intake, the preventive measures that were also taken in addition, fighting flu, and the incidence and duration of the infection of the flu, the virus. So here was the deal. Among children who were reported drinking tea at least 6 days per week, there was a 40% lower risk of being diagnosed with influenza compared to those who consumed tea fewer than 3 days per week. They went on and they said that the subjects that consumed 3 to 5 cups per day had a 46% lower risk of coming down with the flu than those who consumed less than 1 cup a day. So it's there, the opportunity to help yourself just simply with green tea. We know that green tea is a tremendously strong antioxidant, works to protect your body against cancer and other things of that nature. To ignore that and, to keep drinking that cup of coffee, which is acidic and breaks your body down and does things that are not cool, is really not a good choice. There also was a re-look at, if you will, on zinc and flus and colds, and this one it was published into the Open Respiratory Medicine Journal. They come up with some really queer names. Anyway, it concluded that zinc lozenges are beneficial in reducing the length of colds if the mineral is available in sufficient quantities. So it comes down to what is a sufficient quantity. They did several trials, and this was done over in Europe, University of Helsinki, and they selected 13 placebo-controlled trials. So these were, double-blind types of things, and they used zinc lozenges, and 3 trials tested zinc acetate. And 5 trials tested other forms of zinc in daily doses greater than 75 milligrams. The remaining 5 trials evaluated the use of lozenges, and these were just oral lozenges, you sucked on them and so forth, and they contained lower dosages of the mineral. While the test went on over 5 trials, they analyzed the effects of less than 75 milligrams of zinc and found no benefit. Zinc acetate consumed in higher dosages than 75 milligrams per day was associated with a 42% reduction in colds. That's pretty significant. Consuming more than 75 milligrams of other forms of zinc was associated with a 20%. So if you're going to do the right thing, go get zinc acetate for immune boost. And by the way, guys, zinc sulfate, the sulfate form of zinc, is the one that is used most effectively for prostate function problems. See, the dry weight of the prostate is 50% zinc. And as we get older, because zinc is one of those things, one of those minerals that our body uses up in the case of stress, we kind of burn it up and we destroy it, and subsequently the prostate. As a matter of fact, that was a paper that I wrote many, many years ago. Graduating from professional school, I had to have a thesis in nutrition, and it was called Zinc and the Prostate Gland, and that was a study. So we've known about zinc relative to prostate function for many years, but it has to be used in high enough dosages to make a difference. Have a lot of topics, a lot of things I want to talk to you about, a lot of very interesting things in the news, as they say. Some things that you say, well, I didn't know about that. A couple of studies on cancer and inflammatory reactions and so forth. But we're going to get to the phones because they're already lighting up. Sal, how can I help you?
Yes. Am I on?
Yes, you are, sir.
Yes. I was wondering, what would you do to help someone get rid of a kidney stone they already have?
Well, it depends on how big the stone is.
4 millimeters.
All right, so not huge. Are you a stone former? Have you had problems before?
Oh, yeah, I've passed them all before. I've had just 3 others in my life. 2 of them about 30 years ago.
Oh, all right, so there's some things.
3 was like in May, and number 4 is now.
Okay, so that's not a good thing. It says that, you've got a predisposition, which means that your chemistry is not balanced properly, which means that there's things that are going to be deficient in your body. And I'm going to talk about deficiencies. Since I don't know your overall health, I'll give you some guidelines. Number one thing that you have to do is make sure that you're drinking enough fresh water. And an alkaline form of water is going to be the best. So you want to make sure you're drinking, take your body weight. I want you to divide your body weight by 2. And that's the number of ounces that you should be drinking in water every day. You must eliminate things that dehydrate you, like coffees and sodas and so forth, particularly soda. And the reason for that is this. The phosphoric acid in any soda leaches calcium from your bones and shoves it into the bloodstream, and it's going to filter into your kidneys. And if you have a predisposition, it's going to have a problem. You got to get rid of dairy products, and you have to get rid of spinach, and particularly but at least don't eat them together because they will form something called oxalate crystals, and that's going to be a problem for you. But that's where you start. But your dietary patterns then have to be balanced, and we have to know a little bit more about your chemistry. But high levels of magnesium, particularly magnesium glycinate. If you're kidney or stone former, that means that we've got to recombine and rebind that calcium, and you want to do that by taking a minimum of 500 milligrams up to 1,000 milligrams. I would start, in your situation, I would do divided dosages over a period of the day of 1,000 milligrams of magnesium glycinate. The only side effect to magnesium is that it might give you a little bit of a loose stool. If that happens, you back the dose down just a little bit. But at 1,000 milligrams a day, you're not going to get in any trouble. Specifically, most people in this country are highly magnesium deficient anyway. And I have some patients who are taking much more than that. But that will help. That will begin the process. If I knew more about your overall health, but if you just did those things, that would really make a difference. And try that. Let me know.
But there's no way of getting rid of the one I've got.
Yeah, that'll help. Yes, it will.
Stuck with it.
No, not at all. The magnesium glycinate will help begin to dissolve it and bring it up. There's phosphorus levels and phosphorus balance in the body is also critical. We deal with patients with that all the time. If we can help you, I would just tell you, give our office a call and get in to see our nutrition department, and they'll tell you.
Let me ask: do you guys take Blue Cross Blue Shield or Medicare?
We are point of service, which means that if you have out-of-network coverage, then we will file for you, but we are not on an insurance list. So you have to have, for reimbursement in our practice, you would have to have point-of-service coverage, or also called out-of-network service. Sal, thank you for the call. I appreciate it, and if we can be of help to you, we'll be glad to do that. But you've got a problem. It's a metabolic problem. It can be changed. You don't have to continue building stones. I've never seen a patient in all the years that can't do something to make it much better, but also begin to have the body shift its chemical nature and begin to reabsorb these things. Give us a call, 888-630-9625, 888-630-WMAL. Love to talk to you. We're talking a little bit about things in the news, and there's a lot of studies out there. Many of you are on hypertension medication, blood pressure medication. And bottom line is that where you are with anything right now is because of your choices, of things that you've done. Remember, we said there's only 3 things that can cause anything: either injury to the body, affecting the structural system and the nervous system; biochemistry, things you eat you shouldn't; anything that's from the outside in, anything that's exogenous. So the electromagnetic fields, the foods, the pollutions, the additives, the preservatives, all that nonsense. And things that you should be putting more of in your system that you don't get enough of. And the third is stress. So there was an article that came up recently that was talking about protein supplementation and blood pressure. Very interesting, because we've known this for a long time, and I constantly harangue my patients about eating enough protein, because most of you don't. The article was published online in Circulation and the Journal of the American Heart Association. The author was a guy by the name of Jiang He. He's a MD, PhD, and they reported trials of increased protein supplementation in protein-deficient patients and the effect relative to blood pressure. Anyway, he divided 352 people in with what they call prehypertension or stage 1 high blood pressure, and they played with the protein that they were getting. And what they found out is people who had high blood pressure generally had something in common. They weren't getting enough protein assimilation in the body. They weren't getting enough protein. So when they increased the protein, they found that blood pressure, particularly systolic blood pressure, the upper pressure, when you hear somebody say 120/70, it's the 120 that we're referring to that's systolic. The bottom pressure, the diastolic. And they found that it dropped the systolic pressure. It's amazing, because we've noted that for a long time. Patients who are carbohydrate junkies, who eat sugars, who don't get enough proteins, end up with hypertension over a period of time. Now, protein can come from any source. If you're a vegetarian, a true vegan, doing it the right way, there's a way of balancing proteins to make sure. But, eating carbohydrates and pizza and junk and calling yourself a vegetarian is not the way it's supposed to be done. That's not okay. So you need to really step up to the plate and understand that what you put in your body is so important. The fuel that you put into that system called your body is so critical for optimum formation. Remember, there is nothing that occurs by accident. Nothing in your body just happens. Whether it's a cold, whether it's an allergy reaction, whether you have a headache or back pain or sciatica, or you end up with cancer. There's a reason, there's an end product. Some of you can go a whole lot longer before you get to that place. Some of you can't.
Dr. Tom Roselle Live continues now. 105.9 FM and AM 630 WMAL.
Welcome back. This is Dr. Tom Roselle. You're listening to Dr. Tom Roselle Live, 105.9 FM and AM 630 WMAL. How you talk to me today, online or here at the station, is 888-630-9625. 888-630-WMAL. Love to talk to you on any subject you have in mind, and we do have some callers. Please give me a call. Nedgar, how can I help you?
Yes, Dr. Roselle. Taking my call.
Did I pronounce your name properly?
Yes, sir.
I don't want to be offensive.
I have pain in my feet, both my feet, and it comes up and then sometimes it goes away, but most of the time it bothers me. I can't walk. It has limited my motion very much, so I don't know what to do about it. I went to a doctor and he ordered me a shoe, pediatric shoes, but didn't help me. So what can I do and how should I go about to just get relief of it?
Let me ask you a couple questions.
Yes.
How long have you had the pain? Several years? Couple months?
It's like almost a year.
Okay.
Like almost a year yet.
Do you have any back pain?
No.
Okay. Now, the nerves from the back go all the way down the legs and they go into the feet. And you don't have to have back pain, you don't have to have leg pain to have pain further down the line in your feet, the top of your feet, in your calves, so forth. So you have to look at it a couple different ways. First, you would look at whether or not those nerves are involved. If the nerves are being irritated in your low back, you could have foot pain very easily, and particularly that type of pain that would come and go initially. If you have shoes that don't fit properly, that can be a problem. If the muscles of the feet are not balanced properly, so they're not working like any other muscle in the body, then the arch will drop, and that can be a problem. There's a lot of different things that you can do, but just say that you have foot pain doesn't really tell me a whole lot of things, because we could be looking at the ligaments being swollen and irritated. In the body, you have some small little glands sitting on top of the kidneys called the adrenal glands. The adrenal glands put out two interesting hormones. They put out a lot of hormones, but two in this case that we're interested in. One decreases inflammatory response, and the other one strengthens the tissue, particularly the ligament tissues of the body. So if the adrenal system is less optimal, not working as strongly as it should, any of the joint spaces in your body that you would use regularly, so the feet obviously you're using because you're walking all the time and you're stretching the joints and you're constantly putting stress into them, may become affected. So you would have that type of problem. You would have to use, there's some testing that you can do to see if that's part of the problem. But now you're left with weak ligaments, weak tissue, and the feet aren't holding together. So what I would have you do, first of all, and I'm just going to give you guidelines because I don't know a whole lot about your health at this point, is that if you're eating things that increase inflammation, like coffee, like sodas, like sugar, gluten products, those kind of things will make it much worse for you. You need to make sure that you're getting adequate amounts of protein in your body so the body can heal. And you want to increase your vitamin C level to 4,000 milligrams a day. You want to increase your anti-inflammatories from omega fatty acids. Things like turmeric will also help to bring it down. You want to take trace minerals, specifically things like manganese, that will help strengthen the ligaments. But there's much more that can be done. Here's a couple quick exercises to do. Get yourself a golf ball, not a tennis ball, not one of these rolling pins, but a golf ball. And every day, 2 minutes in the morning, 2 minutes at night, put your feet on the golf ball and roll your feet around, back and forth, up and down, side to side on the golf ball. If you find a particularly sore spot, work it out a little bit. The first few times you do it may leave your feet a little sore. Then in addition to that, get yourself a bucket of water that you can put maybe 2 gallons of water in. And put warm water in there, and then put 3/4 of a cup of sea salt in the water and soak your feet every other day, every day if you want to, for about 20 minutes, and that will also take out a lot of the inflammation and also a lot of the toxin out of the feet. Those things will help. Also stretching the calf muscles and the leg muscles. But if it's a back problem, you need to have manual manipulation. Acupuncture can be extremely effective in restoring function to any part of the body, the feet particularly as well. Nedgar, if I can be help from you or to you in any way, please give us a call. We're available. You can go to us online at rosellecare.com. That's ROSELLECARE.com. We'll be happy to answer more questions. One of my doctors will get back to you. Or please make an appointment to come in. But that's something that you can resolve. It just has to be properly diagnosed.
Dr. Tom Roselle Live continues now. 105.9 FM and AM 630 WMAL.
Welcome back. This is Dr. Tom Roselle. You're listening to Dr. Tom Roselle Live. I am in studio. 888-630-9625. That's 888-630-WMAL. Love to talk to you on any subject that you have in mind. I want to remind you that October is Breast Cancer Awareness Month, and thermography centers in a special event, particularly Thermography Centers of Fairfax, is going to help you evaluate the potential problem of breast cancer showing up 5-8 years down the road. Anyway, they're going to offer you a few more days left. I think today is got one more week left to the month. If you give Dareth Painter a call at Thermography Centers of Fairfax and tell her that you would like to schedule an appointment, you will get 20% off on a breast scan. Call her at 703-943-7248. That's 703-943-7248. Thermography Centers of Fairfax. Ask for Dareth Painter, and she will be more than happy to schedule that appointment for you. It's one of the things that you can do proactively to help yourself. It's an adjunctive procedure approved by the FDA, one that you should make part of your annual examination. This is something that my wife will only do. She will not do mammography. Several of my staff members the same. And it takes away most of the false negative reporting that you unfortunately see with mammographic examination. However, give them a call. This is your opportunity. Let's go to the phones. Claude, how can I help you?
Yes, sir. I have a severe case of varicose veins. I've had veins stripped in the past, and that helps temporarily, but it comes back. And I've done exercises, and it soaks my feet, and it hurts, continuously hurts.
Where's the varicose vein? Where's the varicosity?
Oh, in my leg structure around the ankle area.
Okay. Are you in an occupation, or have you been where you're on your feet all the time?
Not really. I sit down at my job, and it started out for virus back in 1990. And it goes to one episode, it goes away and it comes back.
Okay, there's two primary things. There's other things, but there's two primary considerations relative to varicose veins. One is the pressure of your body weight that sits in your pelvis. Your hip bones and your hard matter around your hips is called the pelvis, right? And you have intestinal tract and you have fat and so forth. And the weaker the muscles are that support that structure, or the more weight that you have on your body, the more pressure that you're going to have pushing down into the pelvic area. Now, the reason that's a problem is because the arteries and the veins that go into the legs also go down through there to the legs, down to the feet. Now, as the blood goes down, the blood has to come back up. And if you have a lot of pressure in that pelvis, things that are sitting there too heavily, the blood cannot easily come back up. So you have a stagnant situation where the blood pools, and when the blood pools, it pushes on the veins, and the veins begin to bulge, and that's where you get your varicosities from. So, one, I don't know your size, so take a look at yourself, and if you have too much weight, first thing you got to do is you got to lose the weight. And
I'm 6'1". I'm about 167 in my weight structure.
Okay, so you're not in bad shape at all. So the next thing you have to do is you have to check the muscle strength, the tone. One of the things that I will tell my patients to do to help take the pressure off is, if you got an ironing board at the house, what you do is every day you put that ironing board at about 3 feet off the ground, one end of it, the other end of it on the ground. You put your feet up at the 3-foot level, you put your head down at the other end, and just put a pillow underneath your head and shoulders and lay there for about 20 minutes. That helps reverse the circulation.
Okay.
Now, there's the things that you want to avoid in your diet are things like heavy amounts of red meat, fried foods, things that are soft, that don't allow good circulation and a lot of toxicity. Make sure you're drinking a lot of water. Again, half your body weight in ounces every day will help. Get rid of coffee, get rid of alcohol. Those are going to clog the liver. When the liver is toxic, you're going to have a much greater chance of producing varicose veins anywhere in the body, but in your feet as well, because the reason for it is that you have an artery that comes off and the liver, and it goes down to the lower portion of the abdomen, and it branches off and it goes different directions. A hemorrhoid and a varicose vein in the leg is basically the same type of thing, and you treat them similarly. One of the supplementations that you can use is called stone root, collinsonia. It's the same thing, and you can get it at a health food store, and collinsonia will help tighten and shrink up the vessels so it takes some of the irritation out. Now, make sure that when you take colon soda, you drink a lot of water with it. Vitamin C, high levels of vitamin C will help as well. Vitamin E, particularly the succinate form of vitamin E, is also beneficial in maintaining good circulatory patterns. There's other things, but those are places that you can start. And it should help you, Claude. If I can be of help, you can give me a call at our office or one of my doctors at 703-698-7117, or go online to rosellecare.com and let us know and see if we can help you further.
Thanks a lot, sir.
You're welcome. Thank you for calling. I appreciate it. We're here at 888-630-9625. That's 888-630-WMAL. We're talking about many different things. Age-defying Dara. She's an icon. She is a lady that is absolutely amazing, and she's preparing for the 2012 Olympiads, if you will, and she's 45 years old. This woman's a 5-time Olympian, and she's been all of that and a whole lot more. She just doesn't know the answer. You can't do it. And her quote says, the road doesn't know how old you are, and neither does the swimming pool. And that's amazing. She is, as you know, an Olympic swimmer. But, what's her secret? Why can she do that? If any of you see her, she has, at 45 years old, this woman has a body that is muscular and toned and well fit, and just, she goes on. She's, reaching her goals. She takes one day at a time. She starts picking it apart, her diet, her training, her mental attitude. She is an incredible woman. Her workout structure is one where she puts several things into her system. She makes sure that she gets a lot of protein in her body because she's burning it up. She takes a lot of multiple vitamins and minerals. She takes extracts from superfoods, some of these green foods that you see, potent enzymes. She makes sure that her intestinal tract and her stomach are working, herbs, antioxidants, as we talked about, like green tea and omega-3 fatty acids and so forth, coenzyme Q10, alpha-lipoic acid, resveratrol, quercetin. All these things are going into her system, and she takes most of these, believe it or not, prior to when she works out, as well as branched-chain amino acids, so they get into her system. After she works out, she takes more amino acids to increase the recovery process of her muscles. And listen, you're an athlete, you're an Olympian, just in your day-to-day activities, whether it's out in your garden, whether it's in your home, whether it's in the workplace, and we neglect ourselves. One of the things that you've heard me talk about over time is branched-chain amino acids and how important they are to the healing process, how important they are to something called mitochondria, the energy packs within your body. And these energy boosters, if you will, are their tendency to be depleted or work are inheritable traits. They're linked to the genetic code. But more importantly, when you take branched-chain amino acids to increase the capacity of the mitochondria to make them work more effectively and efficiently, overall energy in the body is boosted dramatically. Even patients who are told that they have chronic fatigue patterns, you get them on branched-chain amino acids, and in many cases, it turns things around almost miraculously. But here's a woman, Dara Torres, and you take a look at her, and she has no intention of quitting. She just keeps putting it together. But she is very detailed about how she treats herself. She's very specific about what she does with her body. How many of us can say the same thing? How many of us can step up to the plate and say, I'm doing everything I know that I should do, let alone there's so many other things that we're not even aware of, but beginning to say, I want to get it done. My book, Ageless Health, Health is a Do-It-Yourself program, takes you through that paradigm, takes you through the decision-making process of how to get emotional leverage on yourself so you can take the next step. It's saddening to me, after 35 years of practice, I look at patients when they come in and I say, oh my God, you could not only prevent this and stop the nonsense, but you can do so much more just to shift and turn your body around. It's up to you. It's really in your hands. Let's go back to the phones. Paul, how can I help you? Thank you for calling.
Yeah, hey, thanks for taking my call. I was diagnosed with Rocky Mountain spotted fever and tick-borne typhus about 6 weeks ago. I'm now finishing up my second round of doxycycline, and there's still no improvement. and I was wondering if you knew. I have an appointment with the infectious disease people, but that's not for another 3 weeks. And I was wondering if you knew of some other treatment, and also, unfortunately, with this condition, is the severe headaches. They're almost like when you drink a Slurpee too fast kind of headache.
You shouldn't be drinking Slurpees anyway, but that's another story. There's several things that you can do. The failure of an antibiotic is sometimes because it's not specific, and the overuse of the antibiotics in certain situations. There are multiple hitchhikers now that are associated with Lyme's and Rocky Mountain spotted fever and so forth, and when they hit you with doxycycline, which is one of the most powerful antibiotics that you can use, sometimes your body just doesn't have the capacity to do what it needs to do to turn things around. So having said that, there's a lot of different steps that you can take. We end up seeing patients who come into our office because of failure of other therapies, and they've been to traditional infectious disease person and so forth, and we're not treating the condition, we're treating the patient to restore and support their immune response. There are herbs out there, things like called spironol and biocidin, and that are very, very powerful herbs when it comes to treating some of these things. Now, whether specific for you or not, I can't make that judgment call because I don't know enough about you. But let me give you the things that lower immune response and just some general guidelines. One, any kind of sugar, particularly refined sugar products, decreases the white blood cell capacity to fend off any infection, any microorganism, by 12% for 8 hours. It's phenomenal. It's very impactful. So you've got to get rid of any kind of sugar in your diet. You've got to bring up your immune response, adding things like vitamin C to your diet. Just very simple things. Add more vegetables to your diet, but don't fry them and don't ruin them. Just blanch them. Vegetable juices, branched chain amino acids, taurine. The anti-inflammatories such as B12, but the hydroxy form of B12. Acupuncture serves to bring the body's energetics back up to a place where it can actually do something. Your body system has to have high enough energy. If your fight-flight system, your adrenal system has crashed, then your body cannot kick in your IgA defense mechanism. Your mucus secretions of Ig antibody causes viruses and bacterium and so forth not to be able to duplicate and grow. So it kind of puts a colony around and stops its maturation. So there's many things, but again, specifically for your situation, it's difficult to make that judgment call because I don't know the state of your health. So start with eliminating certain things to your body. Increase some of the immune function, zinc and vitamin C and omega fatty acids and so forth, and that may be useful. You can get a hold of me anytime. Just drop me a note at rosellecare.com. Give our office a call. We'll be more than happy to help you, direct you. If we can be of use, we'd be glad to do that. Paul, thanks for your call. I appreciate it.
Dr. Tom Roselle Live continues now. 105.9 FM and AM 630 WMAL.
Welcome back. This is Dr. Tom Roselle. You're listening to Dr. Tom Roselle Live. We're here at 105.9 FM and AM 630 WMAL. I'd like to welcome all of our new listeners because of our switch to FM and let you know that we're here every Sunday at 12 noon. Answer your questions on any aspect of healthcare from a non-drug, non-surgical point of view. If I can be of help to you, please visit our website at rosellecare.com. You'll find a lot of fascinating things there, loaded with information. Also, you can go to roselleradio.com. That's ROSELLE radio, RADIO, and check all our past programs, a lot of linkages to some very important things. Janet, how can I help you?
Taking my call. This is Janet. I want to know if you have any natural treatment for skin rash, skin allergy reaction from to hair color.
Yeah, you're going to have to switch it to a natural form of hair coloring. Unfortunately, a lot of the hair colorings are toxic and very toxic to the body. You can use a lot of gentle creams. Calendula cream is one, particularly around the face area where the hair dyes and so forth have come into the forehead and around the face. That may help. But generally, if you're starting to develop an allergic response to hair dyes, it's because your body can't handle it, and it's setting up a tremendous inflammatory response. So, but there are natural products out there. Talk to your hairdresser, talk to your cosmetologist, and ask them if they would do some research for you to find one that is a natural organic form. They are there. So if we can be of help to you, we will. But take that route first. Interesting, we were talking off the break about hairdressing, so it's kind of an interesting call you're calling in. Both of my parents were hairdressers, and so I grew up in that world. But we've, over the years, because we have a lot of patients like you, we've learned that there are natural products out there. There are natural cosmetic products as well. You can go onto our website and look at My Essence. My Essence is a natural product, but those are just facial cosmetic products. We're not talking about hair there, but they do exist. That's about as good as I can. You can desensitize those, Janet, like you can desensitize any other allergen, which we do in the office, and we take you through the different types of environmental things. But your body is not responding, and we have to find out why. Janet, thank you for calling. I appreciate it. Keep listening to the program. We have 2-3 more phone calls, and we're coming up to the end, and unfortunately I can't take them. I apologize. I hate to do that to you, but you can give us a call at 703-698-7117 or go online at rosellecare.com and check us out. Write us a note. I will answer your notes myself. May have one of my docs call you, but we will always get back to you. If I neglect, it's because I haven't gotten it, so try again. We're here every Sunday. This is Dr. Tom Roselle. You're listening to Dr. Tom Roselle Live. See you next week. Bye.